Hi everyone, I'm EForbes. I'm a registered dental hygienist. Today I will be showing you the steps on performing a routine oral cancer screening. First, you need someone to screen. A dental mirror and 2x2 gauze, air water syringe, and a dental light. Before you start examining inside of the mouth, you want to palpate under the chin, feeling for any asymmetrical areas, bumps, lumps, or anything else that feels out of the place. Normally I would have my mask on for this, but so that you can understand me better, I'm going to leave it down for demonstration purposes. So we will start by examining the lips, looking at the vermilion border. Here you can see it is very clear. The lower lip is often a common spot. The lower lip is also a common area where cancers form. So you want to check that to make sure that you don't see any lumps or bumps or lesions. Next, can you just open for me, please? Thank you. You can retract the cheeks looking at the inner lining of the buccal tissue. You want to carefully examine. Note here I see a cheek bite. That's a little red lesion. That's normal. That's nothing to be concerned of. Sometimes you'll see what's called linea alba, which is a white line on either side of the cheek. Again, nothing to be concerned with. Next, we will examine the roof of the mouth, checking again for any abnormal colors, textures, lesions. My patient has a torus on the top of her mouth. That's just extra bone, that's normal, and no need for concern. The gum tissue also should look pink in color. The papilla should be firm and triangular. This person seems to have very healthy gums. Next, I will ask the person, I'm going to take my 2x2 gauze and wet it. The reason that I wet the gauze is because if you don't, I find that when you have the person stick their tongue out so you can fully examine the tongue, if the gauze isn't wet, the tongue sticks to the gauze. So this makes it a lot easier and makes the patient more comfortable. So I'm going to ask you if you can please stick your tongue forward for me as I examine the lateral borders of the tongue. This is another spot that is very common where you see lesions, malignant lesions, can appear. So I'm going to flip the tongue over gently and examine for any papilla that might be inflamed, any colored discolorations. It looks good to me. With my dental mirror, I'm going to examine the soft palate and the uvula. Can you say ah for me? Ah. Good, thank you. Nice. All right. The floor of the mouth is next. You can palpate using one digit and just palpate to feel for any lesions or any bumps or lumps. I am not finding any in this patient. You can feel the condyles of the TMJ the farther you go back. Feeling the bone also makes us know that there's no cysts or tumors developing that we can feel. Oddly enough, she doesn't have any tori on the bottom, just on the top. Go figure. So, upon this complete examination, I have not found anything of suspicious areas. I can confidently say that this oral cancer screening is negative. But what would you do if you did see something that was of concern? You notify your doctor, and most likely they would refer that person to an oral surgeon where they would biopsy the lesion, fully removing it, and hopefully anything. Thank you for watching.